There are many factors that contribute to a great custom product, but a good ear mold impression is probably the most important. Great impressions will almost always result in better quality, better fitting custom hearing aids. In order to ensure you take a good impression, there are some things to consider. This is not meant to be a complete guide on impression taking, but it will give you some tips that can lead to better outcomes and help you identify the standards that define a quality impression. First, be sure to have the proper equipment. Silicone impression material is the most commonly used material and is easier to work with than a powder material or a liquid material. Always check the expiration date of your impression material to ensure freshness. It is also a good idea to have a pen light handy to help you see into the ear canal. After reviewing the user's history and examining the ears, it's time to take the impression. You'll want to gently insert the otoblock far enough into the adult ear canal so that it rests approximately 4 millimeters beyond the second bend, or 16 millimeters past the aperture. The best way to ensure this is to mark the otolite 16 millimeters from the tip. When taking an impression, make sure no one else is in the immediate vicinity. And it's best to stand at eye level in order to be comfortable and have a great view of the ear canal. Begin by aiming the impression material into the larger opening of the canal, not the canal wall. This will help reduce possible gaps. Regardless of the style you plan to fit, fill the entire concha bowl and helix with impression material. This will ensure that you include the most ear anatomy possible. You want the impression to capture the second bend and approximately 4 millimeters beyond. After removing the impression, evaluate it. Determine if there are any issues that might result in a poor fit or poor cosmetics. Some things to consider or to look for are cracks, air bubbles, voids, excess material, marks left by anatomical issues such as moles, hair, underfilled helix, underfilled canals. A good guide for canal evaluation is the 16-4 rule. The entire canal should be 16 millimeters or longer and or 4 millimeters in length beyond the second bend. If the impression doesn't meet the standard, ask the patient to take another impression. It's so much easier to take a second impression now while they're in your office if it means avoiding a remake or having a patient unhappy. Once you've done a thorough evaluation and determined that you have a quality impression, be sure to mark any unavoidable dents or voids that were caused by the user's real ear anatomy, such as moles, exostoses, or other growths. This is an important step because if these are not marked, the manufacturer may assume it is a void and fill it in, which could cause comfort issues for your patient. After that, it's ready to send off and returned as a great resound custom product. The more practice you have at taking impressions, the better your customs will be. Good impressions are the foundation to discreet and great fitting custom hearing aids and will usually result in less remake. This can help us achieve the ultimate goal: more satisfied patients.